Welcome to Lesson 3.3, Dementia Care. Providing care for someone living with dementia requires patience, observation, flexibility, and strong communication skills. A client may forget information, repeat questions, become confused about where they are, resist assistance, experience changes in mood, or have difficulty explaining what they need. Our responsibility is not to argue the client back into reality. Our responsibility is to understand what the client may be experiencing and provide safe, respectful, person-centered care. Dementia is a general term describing changes in cognitive abilities that become significant enough to interfere with everyday life. A person living with dementia may experience changes in memory, communication, judgment, problem solving, behavior, or their ability to complete familiar activities. Dementia is not one single disease. There are different diseases and conditions that can cause dementia. It is important to understand that dementia is about much more than forgetting someone's name. A client may have trouble understanding what you are saying. They may know what they want to tell you, but struggle to find the words. They may become confused in a familiar environment. They may have difficulty completing a task they have performed thousands of times before. Understanding this helps care partners respond with patience rather than frustration. Alzheimer's disease and dementia are often used as though they mean exactly the same thing, but they do not. Dementia is the broader term. Alzheimer's disease is one type and is the most common cause of dementia. Different clients may experience different symptoms, abilities, and progression. That is why we care for the individual person rather than making assumptions based only on a diagnosis. Person-centered care means remembering that the client remains an individual with preferences, history, relationships, routines, and choices. Dementia does not erase the person's identity. Learn what the client enjoys. Learn their normal routine. Understand what makes them comfortable and what may upset them. Whenever safely possible, involve the client in decisions about their own daily life. Communication may become more difficult as dementia progresses. Approach the client where they can see you. Use a calm tone and simple language. Give one instruction at a time rather than several instructions all at once. Then give the client enough time to process what you said and respond. Quiet one-on-one communication with fewer distractions can also make conversations easier. Arguing with someone who is confused usually does not solve the confusion. It may increase fear, frustration, embarrassment, or agitation. If a client repeatedly asks the same question, remember that they may genuinely not remember asking it before. Statements such as, "I already told you that 5 times," do not help. Stay calm, respond simply, reassure the client, and redirect when appropriate. The National Institute on Aging specifically recommends patience, reassurance, and avoiding arguments when responding to dementia-related behavior changes. Imagine a client says, "I need to go home," even though they are already home. Simply saying, "You are home," over and over may increase frustration. Instead, pay attention to the emotion behind the statement. The client may feel frightened, unfamiliar with their surroundings, or be looking for the sense of safety that the word home represents. You might offer reassurance, sit with the client, talk about something familiar, or redirect them toward a comforting activity. A client living with dementia may ask the same question repeatedly or tell the same story several times. They may not remember that the conversation already occurred. Respond as calmly as possible. Visual reminders, familiar routines, calendars, signs, or other approved supports may sometimes help. Most importantly, do not shame the client for something they cannot control. What we sometimes call a difficult behavior may actually be the client's way of communicating an unmet need. A client who cannot clearly say, "My hip hurts," may become restless or irritable. Someone who needs the bathroom may begin pacing. Someone overwhelmed by noise may become agitated. Instead of immediately labeling the client as difficult, look for possible triggers or unmet needs. If a client becomes agitated, your response can either decrease or increase the situation. Stay calm. Lower your voice rather than raising it. Reduce unnecessary noise and activity when possible. Give the client personal space. Listen to what they are trying to communicate. Reassurance, reducing environmental stressors, and redirecting attention are recommended approaches for dementia-related agitation. A care partner should never respond to dementia-related behavior with threats, ridicule, intimidation, physical punishment, or unnecessary force. If a client becomes aggressive and you cannot safely manage the situation, protect yourself and the client. Create safe distance when possible, and follow agency procedures for obtaining assistance. Never retaliate against a client. Redirection means gently shifting the client's attention away from something causing distress and towards something safer or more comforting. You might play familiar music, look through photographs, offer an approved snack, fold towels together, or begin another meaningful activity. Meaningful activities can support quality of life and may help reduce agitation or wandering behaviors. A predictable routine can provide structure for someone whose environment may sometimes feel confusing. When possible, follow the client's established care plan and routine. Major unnecessary changes in schedule or environment can sometimes contribute to distress or confusion. That does not mean every minute must be identical every day. It means providing as much safe familiarity and consistency as reasonably possible. Bathing, dressing, grooming, and toileting may become difficult for someone with dementia. The person may not understand why you are removing their clothing or trying to bring them into a shower. That can feel frightening or invasive. Explain each step. Offer simple choices. Protect privacy. Move at a comfortable pace. If a client becomes extremely distressed, forcing the task may make the situation worse. The National Institute on Aging notes that bathing can sometimes feel frightening, embarrassing, or uncomfortable for people with Alzheimer's disease. Open-ended questions can sometimes become overwhelming. Instead of presenting an entire closet and asking the client to decide what to wear, offer two appropriate choices. This preserves the client's ability to make decisions while reducing unnecessary confusion. The same approach can be used with meals, activities, grooming, and other daily routines when appropriate. People experiencing memory problems may be at risk for wandering or becoming lost. A client may say they need to go to work, find their children, go home, or search for someone from their past. Pay attention to patterns. Follow the client's care plan and agency safety procedures. Never leave a client requiring supervision unattended simply because they appear calm at that moment. If a client begins attempting to leave or wander, stay calm. Avoid turning the interaction into an unnecessary physical confrontation. Try to determine what the client is seeking. Maybe they believe it is time to go to work. Maybe they are looking for someone. Redirect the client toward another safe activity when possible and follow the client's individualized safety plan. Environmental safeguards and structured meaningful activities are among strategies commonly recommended for wandering risk. Some individuals living with dementia experience increased confusion, agitation, anxiety, or restlessness later in the day. This is commonly called sundowning. Helpful strategies may include maintaining a regular routine, reducing evening stimulation, providing appropriate daytime activity, identifying triggers, and scheduling more demanding tasks earlier when the client is typically more alert. Always follow the individual client's care plan. The environment can affect behavior. Television noise, multiple conversations, clutter, unfamiliar people, or constant rushing may become overwhelming. When a client appears distressed, consider what is happening around them. Reducing distractions and creating a quieter, comfortable environment may help reduce agitation. Dementia can affect judgment, orientation, balance, and a person's ability to recognize hazards. Someone may forget how to safely use an appliance or may become lost in a familiar location. Home safety needs may also change as dementia progresses. Care partners should follow the established care plan and report new safety concerns rather than independently making major changes to the client's home or routine. This is extremely important. When you care for someone with dementia, you need to learn what is normal for that individual. A sudden change from their normal behavior, mental status, strength, mobility, or alertness should not automatically be blamed on dementia. Observe what is happening and report significant changes promptly according to agency procedures. If symptoms indicate an emergency, follow the agency's emergency response procedures immediately. Some clients may experience hallucinations, delusions, or suspicious thoughts. They may believe someone stole something. They may believe someone is inside the home. They may see or hear something that you do not. Do not mock or ridicule the client. You also do not need to argue aggressively about whether the experience is real. Respond to the person's fear. Reassure them that you are there. Maintain safety and report significant changes according to agency procedure. The National Institute on Aging recommends calm reassurance and avoiding arguments when responding to dementia-related behavioral changes. Dementia does not mean a person suddenly becomes incapable of doing everything. Abilities may remain in many areas. Encourage clients to continue participating in safe activities they can perform. Activities can often be adapted as abilities change, allowing the person to remain involved and maintain a sense of purpose. A diagnosis of dementia does not erase a client's rights. Never talk about a client as though they are not present. Never make jokes about memory loss or confusion. Never infantilize an adult client by speaking to them as though they are a child. Include them in conversations and decisions to the extent they are able to participate. Treat every client with dignity. Documentation is especially important in dementia care. Avoid labels such as crazy, difficult, bad, violent, stubborn, or out of control. Describe what actually happened. What did the client say? What did the client do? What happened immediately before the behavior? What actions did you take? Did redirection work? Who did you notify? Objective documentation helps the care team identify patterns and make appropriate care decisions. The best answer is C. Repeatedly confronting the client with distressing information may unnecessarily increase sadness, fear, or confusion. Instead, acknowledge the emotional need. You might say something reassuring and then redirect the conversation toward a familiar memory, photograph, activity, or comfortable area. The goal is not to win an argument. The goal is to reduce distress while maintaining safety. Remember the word calm. Communicate simply. Avoid arguing. Look beyond the behavior to determine what the client might need. And maintain safety and dignity throughout every interaction. When dementia care becomes challenging, calm can help you remember the foundation of your approach. Let's review. Dementia is not one specific disease. Arguing may increase confusion, frustration, or agitation. Behavior can sometimes communicate unmet needs such as pain, hunger, fear, fatigue, or needing the bathroom. Wandering risk requires calm supervision, redirection, and following the client's safety plan. And sudden changes must be reported because they may represent something different from the client's usual dementia symptoms. You have completed Lesson 3.3, Dementia Care. Remember that the person living with dementia is still a person deserving dignity, patience, privacy, choice, and respect. Communicate simply. Avoid unnecessary arguments. Look for needs behind behaviors. Use reassurance and redirection. Maintain a safe environment. And always report significant changes from the client's normal condition. Next, we will continue Section 3 with Lesson 3.4, Meal Preparation and Nutrition.